Welcome to Next Anatomy. Today's topic is cerebellum. When you try to see the brainstem with brain pons and the medulla oblongata, so at the junction of the pons and the medulla oblongata behind, you could able to identify on either side, right and left cerebellar hemispheres are interconnected. Of course, the cerebellar hemispheres are interconnected by vermis. In between, you could able to identify a cavity. So now this cavity is called as the cavity for the fourth ventricle. Cerebellum is the largest part of the hindbrain and almost the second largest part, termed as little brain, weight almost approx of 150 grams. And when you study the skull of anterior cranial fossa, middle and the posterior cranial fossa, here it occupies the posterior cranial fossa. As said that the cerebellum is separated from the pons and the medulla oblongata through a cavity called as the cavity of the fourth ventricle. Right and left cerebral hemispheres are united by vermis. Same likewise, when we study cerebrum also, right and left cerebral hemispheres are interconnected by corpus callosum. Here they have been interconnected by vermis. Then we have two aspects of vermis called as superior vermis and the inferior vermis. And we categorize them by two surfaces. The superior surface, which is convex towards the superior vermis, where the inferior surface will forms a deep notch. I'm going to call them as valgula. On the anterior cerebellar notch, pons and the medulla oblongata were being accommodated, but on the posterior cerebellar notch side, when we study the dural folds, we have is the falx cerebelli, which separates the right and left cerebellar hemispheres by the falx cerebelli. So that we could able to accommodate as posterior cerebellar notch. So now here in this picture, you could able to identify one edge of the cerebellar hemisphere. This is the another side of the left side cerebellar hemisphere. At the central, we can call them as an interconnection. We can call them as the worms. On the superior aspect, she could able to identify the superior aspect of the vermis, and we could able to identify the inferior aspect of the vermis. We had is a right and left cerebellar hemispheres. As said, they are interconnected by vermis. Now we will be studying the subdivisions of the vermis. We will be studying the subdivisions of the cerebellar hemisphere. Before that, we should know what are all the fissures that are going to be located. So we have a very important fissure, so that is called as the horizontal fissure. So at this level, we could able to mention of the horizontal fissure, which differentiates the cerebellum into the upper half and then lower half. So now this upper level, I am going to call above the superior, above the horizontal fissure, we are going to call them as the upper half or the superior half of the cerebellum, and the below the horizontal fissure, I could able to connect them as the lower or the inferior half of the cerebellar hemisphere parts. So this is the main fissure which differentiates. Thereby, this differentiates even the blood supply when you study even on the last. Then we have two more fissures called as the primary fissure and the posterolateral fissure. Those two fissures will differentiate the cerebellum into lobes, and we do name them as the anterior lobe, posterior lobe, and the flocculonodular lobe. So we could able to term that the anterior lobe and the posterior lobe are separated by primary fissure. So at this level, we will be having the primary fissure on either side, which differentiates the cerebellum into an anterior lobe, and this one I could able to term them as an anterior lobe, and I could able to term them as the posterior lobe. The second most point is to remember is like the posterolateral fissure separates the posterior lobe from the flocculonodular lobe. So we'll have a nodule in the vermis, and also we have a flocculus on either side. So means all these accounts for us, this is the posterior lobe. So thereby we'll get it out that the posterior lobe was been intersected by horizontal fissure, yes or no? Yes. So horizontal fissure differentiates into only one term, upper half and lower half of the cerebellum. But when you connect only for the lobes, I'm gonna talk only the primary fissure, posterolateral fissure. Primary fissure differentiates into the anterior lobe and posterior lobe, and the posterolateral fissure. So now this would be our posterolateral fissure, which differentiates a larger posterior lobe and a smaller flocculonodular. Here you could able to identify number one. So now this will be our primary fissure, and this will be our posterolateral fissure. So thereby we got the anterior lobe, we got the total posterior lobe extent, and then we have floccula called as flocculonodular lobe. So we had is the three important lobes to be discussed. And also, as I said initially, we had two halves were being separated by a horizontal fissure, which is intersecting in the middle of the posterior lobe. And in the next phase, we will be talking about the vermis. So now this is one side half of the right cerebellar hemisphere. This is another half of the left cerebellar hemisphere. In the middle, we will be having the vermis. In the vermis, we will be studying about the subdivisions of the vermis. So I have mentioned in the short forms. You can remember anterior lobe corresponds to the vermis by three important subdivisions called as LCC as a short form, called as lingula, central lobule, and the culmen. Thereby, you could able to identify the other subdivisions of the vermis corresponding to the posterior lobe, DFT-PUN. So you can remember as declive, foliate, tuber, pyramid, and uvula. And the N stands for the nodule. So do remember all the subdivisions of the vermis, cerebellar hemispheres in parallelly with the vermis. Towards to the lingula, we don't identify any cerebellar hemisphere subdivision, but central lobule is in relation with the ALA, and the culmen is in relation with the anterior quadrangular lobule. So what are all the subdivisions of the vermis in relation to anterior lobe, lingula, central lobule, culmen? What are all the subdivisions of the cerebellar hemisphere in relation with the anterior lobe are ala and anterior quadrangular lobule. Then we'll move on to our posterior lobe. The subdivisions of the vermis are declive, foliate, tuber, pyramid, and uvula. So exactly the same cerebellar hemisphere subdivision we identify In parallel with the declive is posterior quadrangular lobule. For foliate, it will be superior semilunar lobule. And for the tuber, inferior semilunar lobule, and few textbooks didn't commented about the gracile lobule. You can add on an additional point. Inferior semilunar lobule and a gracile lobule. And in relation with pyramid, we had is a biventral lobule, and with uvula, we could able to remember the tonsil. This all corresponds about the posterior lobe of the cerebellar hemisphere. Same likewise. In nodule, we could able to identify one last subdivision of the vermis. Nodule is in relation with the separate flocculus. So togetherly we do name them as flocculonodular lobe. So thereby this diagram will help you to study both the subdivisions of the vermis, subdivisions of the cerebellar hemisphere, learning about the fissures and differentiating about the lobes. This is the tabulation which I kept in very clear to identify in the mnemonic version the subdivisions of the vermis and the subdivisions of the cerebellar hemispheres. So when I study the cerebellum, we had morphological subdivisions. You can remember a word called APM, called as archicerebellum, paleocerebellum, and the neocerebellum. So how the cerebellum was started developing from fishes, amphibians, reptiles, eels, and mammals, so that as evolution progresses, the development of the cerebellum also started growing in. So in the lower forms in fishes and amphibians, you could able to identify only the subdivisions of the lingula and the nodule. And you ascend up into the paleocerebellum of reptiles and aves. You could able to see the additional developments of the anterior lobe except lingula already because lingula was already been developed. And as already nodule was been developed, so added by pyramid and uvula, slowly the cerebellum started growing in with their functional activities. And when you try to see the evolutionary aspects of the neocerebellum in the mammals, including humans, already which was been developed, posterior lobe except a pyramid and uvula. So means the remaining part of the posterior lobe was being developed in the neocerebellum. So likewise, you could able to see the evolutionary development of the cerebellum. And in parallelly, what does the lingula and the nodule does? They maintains the equilibrium of the body, tone, and the posture that itself gives the development of the archicerebellum, where we studied. And once still the evolution has been progressed, the anterior lobe was further developed. The pyramid has started developing. Then automatically we could able to see an added movements of tone, posture, and crude movements were been added now in the paleocerebellar development. Then in the mammals and including in humans, already prior to it, lingula nodule was developed. Then remaining part of the anterior lobe and pyramid was developed. So who all left for us? The remaining part of the posterior lobe. So while they were been developing slowly, an added function was started added that's called skilled voluntary movement. So as we see the progressive development, so that's why we could able to see the skilled voluntary movements mainly in the mammals, that is especially the human beings. In this morphological subdivisions, you could able to identify the archicerebellum is the oldest part, which as I already mentioned, it is responsible in maintaining the position of the body. Paleocerebellum maintains the crude movements by different tracks, which as mentioned in archicerebellum, vestibulocerebellar, spinocerebellar, and the cortico-pontocerebellar, which maintains the skill voluntary movements. Later, when we study about, up till now, we have studied the external features, fissures, lobes, subdivisions of both vermis and cerebellar hemisphere. Now we try to move into the internal features of the cerebellum, where the cerebellum which been differentiated into an outer gray matter and an inner white matter. So now inner core of white matter, again I could able to identify the masses of gray matter which are cored inside the white matter. So that's why we name them as the intracerebellar nuclei. And they are present on both the cerebellar hemisphere. So you could able to see here the cut section in the midline at the vermis level, and you could able to see the right half of the cerebellar hemisphere. You could able to see the left half. And this will be our outer gray matter, and this will be our inner white matter. So inside the inner white matter, you could able to identify the core of gray nuclei, which we could able to term from laterally, and I go into the midline medial. That's why we could able to term them as from lateral to medially. Like could able to remember A, B, C, D, E, F. Like alphabet letters, you omit A, B, C, then you could able to see D for dentate, E for emboliform, and you just reverse the alphabet. So you could able to get your globose and vestigial. So what all the intracerebellar nuclei, dentate, emboliform, globose, and the vestigial. And then histologically, we could able to study about the cerebellar cortex. We study very three important layers. So that is called as a molecular layer, Purkinje layer, and the granular layer in the outer gray matter. And already inside the inner white matter, you could able to identify different types of fibers called as the climbing fibers, mossy fibers, so and different types of axons we could able to identify which interconnects with the cerebellar cortex. Moving on to the, after learning the internal features, we could able to move on to how the cerebellum was been linked with the other regions of the CNS by peduncles. So the bridging of the structures, we could able to call them as cerebellar peduncles. So through these peduncles, what happens, the afferent and the efferent fibers are grouped each other by three different large bundles as superior cerebellar peduncle, which is connecting to the midbrain, middle cerebellar peduncle, which is connecting to the pons, and the inferior cerebellar peduncle, which is connecting to the medulla oblongata. So these terms you could able to recall when you are studying about the brainstem. We said that an important word while you are studying the pons, anterolateral aspect of the pons in the anterior aspect, you seen the transverse fibers on either side interconnects from MCP called as middle cerebellar peduncle. You studied the posterior aspect of the pons, thereby you studied that SCP superior cerebellar peduncle. And when you studied the medulla oblongata on either side, you studied a word called as ICP, called the inferior cerebellar peduncle. This is how is the connections where you observe the three large bundles which carries the both afferent and efferent fibers connecting the brainstem from the cerebellum. So you could able to see in this photograph also at the side view of the photograph, you could able to identify the SCP superior cerebellar peduncles, and also you could able to identify the middle cerebellar peduncle, and thereby lower down you could able to identify on both the sides the inferior cerebellar peduncles. Now this is the cerebellum, and now this will be our midbrain, pons, and the medulla oblongata. So now they were being interconnected by the three peduncles, superior, middle, and inferior cerebellar peduncles. And when you study, we are supposed to know about the connections. So they always connect from the cerebral cortex, and finally they reach the information, the afferent fibers, to the cerebellum. And while the efferents were descending downwards, they may pass through thalamus, they may pass through midbrain, red nucleus and tectum, nor they pass through pons, nor they pass through the midbrain, pons, medulla oblongata. The gray nuclei were being separated and form an aggregation to form reticular nuclei called as reticular formation. Or they may pass through the medulla oblongata via through the olive. Nor at the anterolateral aspects we had is the vestibular nuclei. So at different portions, even from the spinal cord. So this is the diagram which represents you both afferents and efferents which are passing through. Mainly, now these are the terms which I have coined now. You could able to understand for the from the cerebral cortex. I am now reaching to the cerebellum via through pons as pontocerebellar means like ease of to understand from cerebral cortex via pons to cerebellum. From cerebral cortex via reticular formation to cerebellum. So we do name them as pontocerebellar, reticulocerebellar, olivocerebellar, vestibulocerebellar, cuneocerebellar, spinocerebellar. So these are all our your afferents, and through efferents again from cerebellum through red nucleus and thalamus I do exit as cerebello-rubral and cerebello-thalamic. So this is a logical understanding. You're supposed to understand that from where I started and through whom I went and where I have landed. So the afferent pathway you're supposed to understand. Hereby they gives you more clear clarity about which I have conveyed. Cortico pontocerebellar, they conveys the control from the. So you could able to see all the three tracks, cortico ponto, cortico olivo, and cortico reticulocerebellar. They conveys control from the cerebral cortex via through pons, olive, and the reticular formation. Then when you come from the spinal cord to the cerebellum, you could able to identify they are going to convey the information from muscles and joints by anterior and posterior spinocerebellar tracts. Even vestibular nuclei will have its own specific function. They conveys the position movement of the head. These are all your afferent pathways to be remembered. And this is the diagram from cerebellar cortex. And finally, how do I reach to the cerebellum? The tracks were being mentioned in a diagrammatic format. Even you could able to identify anterior and posterior spinocerebellar tracts. Here you could able to study about another pathway called as this globus emboliform rubral pathway, dentothalamic. These two tracks, different pathways, will influences the motor activity so that they maintains the same side motor activities. If it is controlling the right cerebellar hemisphere, controls the right half of the all the body activities. So on the same side, influences the ipsilateral motor activities. And dentothalamic also does the same. And if you could able to have a note on it, vestigial vestibular and vestigial reticular, they influences the same side extensor group of the muscle tone. All the extensor. So means on a gross manner, when you see the different pathways, they control all the motor activities. And this is the photograph representing the pathway. And this photograph represents all the afferents and the different pathways are been grouped away in a single diagram. That was I was mentioning. We started from cerebellar cortex from here and through different segments of midbrain, pons, medulla, and spinal cord. Finally, we reach to the cerebellum afferents, and in return, we are going to connect them as efferents. Then we talk about the blood supply. As I mentioned initially when we are studying the external features, the horizontal feature differentiates into your superior half nor upper half and the inferior nor the lower half. So now basics, when we know the right and left vertebral artery joins together to form the basilar artery. So now the basilar artery will use of a branch called as one of the branch called as superior cerebellar artery supplies to the superior or upper half of the cerebellum. So now this is where you could able to remember the superior half of the cerebellum has been supplied. Inferior half will be supplied into two portions, upper half and lower half. That is the anterior inferior cerebellar artery and the posterior inferior cerebellar artery supplies to the inferior or the lower half of the cerebellum. So here an important point is like the superior and anterior inferior cerebellar arteries are the branches of basilar artery, but vertebral artery will use of, as we studied during spinal cord, anterior spinal artery, posterior spinal artery, we see they are giving branches. Also, it have a note that posterior inferior cerebellar artery is also the branch of vertebral artery in turn supplies to the lower portion of the cerebellum. Coming to the clinical anatomy, so we studied by developmental like archicerebellum, paleocerebellum, and the neocerebellum. Here we could able to make a connection called as the cerebellar lesions, nor trauma, or nor occlusion, or tumors will produce different signs and symptoms. One I could able to take up in short and clear by developmental phases. Developmental structures which are been derived from archicerebellum, those got involved. So in those patients, what happens, they have an unsteady gait while standing, and they will be representing a staggering while walking, means he walks with the leg well apart. Generally we walk normally leg to leg, step to step. So these people, what they do, they take a wider way of wider base in stepping to the next step, sways from side to side, and his limb also will sways from side to side, leading to truncal ataxia and staggering gait. And this person also will have involuntary to and fro oscillatory movements of the eyeball. And we do look normally side to side, and these people will be having involuntary to and fro movements of your eyeball from side to side, call them as nystagmus. So now these patients are unable to maintain balance when they stand upright. And we ask them to stand, they will stand normally, but one they will start falling on usually closing their eyes. We could able to see more of diminished muscle tone, leading to the lack of stability of joints, called as flyal joints, and patellar tendon reflexes. So we do test them by pendular knee jerk. So what happens, disturbed tendon reflexes can be seen in them. So when you tap the patella, with the knee hammer, so they produce oscillatory movements of the legs continuously, leading to pendular knee jerk. So we see those disturbances and inability to maintain balance. So they can't walk in an normal walking balance. So they lose their imbalance, so leading to truncal ataxia and inability to maintain. And in the persons where the neocerebellum got affected, means almost what is the function of neocerebellum? Skilled voluntary movements. So all the muscular incoordination is seen as usually, which are being transferred from paleocerebellum. So asynergia. In these people, what happens, we could able to see they cannot able to measure the distance correctly reaching the intended target, called as dysmetria. So means we will ask them that how will I know that he is suffering with the dysmetria, inability to point the distance. There are a lot of typical examples. Are the one example if you try to take, we will ask them the patient to take their finger and to touch their nose. So now here it was being tested by finger nose test. If the patient was asked to touch the tip of his nose by his finger, What he does, generally he is supposed to go and touch his nose, come back. Again, I will ask him to touch the nose. He could able to touch and he could able to come back. But what happens here is like the patient cannot able to touch his nose and he try to correct the mistake. So first will, instead of touching the nose, he may touch the upper eyelid or chin. So he cannot reach to the intended target. So likewise, we could able to analyze that he could not able to match the distance correctly, called as dysmetria. Intentional tremor probably due to continuity symptom of dysmetria, that is the tremors occur in a purposeful movement and finally they disappears with rest. And also dysdiadochokinesia, inability to execute alternative movements in rapid succession. We'll ask them to do pronation, supination, or we ask them to do clapping in two different pathways of pronated, supinated positions. They could not able to execute those alternative successive movements, so leading to dysdiadochokinesia. And this is all about the short summary of the cerebellum, which we could able to convey. So we could able to comment by their introductory points, their external features, their fissures, their lobes, and their subdivisions of vermis and cerebellar hemispheres. Then you go with their internal features and you comment them as the intracerebellar nuclei. Then give the connections of the peduncles, their afferents, efferents, and comment on histological word and morphological development with their morphological clinical signs and features. So stay tuned to the next video and do listen again and stay tuned to next anatomy.